Okay, awesome. Hey, Edith, good to see you. Good to see you. How are you doing? Awesome. I know it's like a Wednesday, or actually it's a Tuesday. Tuesday at 4 p.m. Welcome, Mikester. How are you? How are you? Looks like we got people slowly rolling in. It's about a 4 p.m. Eastern Standard Time. What time is it for you? Is it also 4 p.m. or is it some different time? That's what I'm curious about. If it's 4 or 3 or 2 or whatever it is. But, we'll just give people 4 p.m. Eastern Standard Time. Nice. So we'll just give people a little bit of time to start rolling in. Yeah, this is going to be probably like an hour, hour and a half. Because later this evening, I'm going to go get dinner. I'm getting dumplings today. So a little bit different than the usual thing that we have for lunch, but we do what we can. So hey, Glock 77. So yeah, now is our chance. Whatever questions we got here, let's see what we can go through. So let's see. Nenji says, do you recommend beta blockers for anxiety? Yeah, so good question. So beta blockers, they're really helpful for anxiety as long as you can tolerate the blood pressure. Specifically propranolol, that's the only one that we use. Really in psychiatry, we don't really use some of the others like metoprolol because those are more cardiogenic. They're not really, they don't really help anxiety in the brain. But the propranolol crosses the blood-brain barrier, so it helps brain anxiety, as well as it calms down a lot of the fight and flight stuff too. So favorite memory of your med school journey? Probably in our 4th year, we did a 5-day canoe camping trip. I did a wilderness medicine rotation. And so in that wilderness medicine rotation, we went upriver. And when we went upriver, we then went downstream, down the river canoeing. And like we would canoe on a campsite or on the bank for all the different nights. And yeah, just having to pack all our supplies. We would literally canoe all of it downward. Down the river, all the food that we had, had a cooking stove and everything. So yeah, that was one of the most coolest memories that we had. And during that time, like I had a bunch of ghost stories that I brought, and so I became the de facto ghost story reader for the camping trip. And it was also nice because it was right after we had all submitted our match list, and before we matched into, we found out where we matched. So because of that, it was like the no stakes, no pressure med school camping trip. So completely worth it. Yeah. And like, yeah, I've never had a unique experience like that again. What do you think of fluvoxamine for OCD versus clomipramine? So clomipramine will probably have more side effects than fluvoxamine. I like to start with fluvoxamine first just because it's an SSRI. But then after that, then I'll switch over to clomipramine if the Luvox didn't work. April B says helping residents navigate their psych residency programs. Nice, that's awesome. Yeah, we had a pretty cool residency coordinator too in residency, and especially when I was in fellowship, we had a really cool one. Yeah, I still talk to her from time to time. She kind of viewed it as her little family for 2 years. So she was very like loving and respectful and very kind with us. So I'll always remember her. I just stopped taking Tegretol last week abruptly, and I have a static feeling over my whole body. Yeah, most psych meds are better when you withdraw from or when you taper off of them rather than coming off overtly. Like you shouldn't be coming off that quickly off of them. I can't poo without thinking about her. What do I do? Okay, don't think about her. Think about yourself and you leveling up instead of thinking about some girl who may have left you. I was the coordinator, now I manage the coordinators. Nice, coordinator, manager. Yeah. Just for the psych program or just like residents in general? What causes bad sleep inertia on Lexapro 10 milligrams for 3 months now? I'm not sure what you mean by sleep inertia. How do you pronounce your name? So Agam, A-G-A-M. That's how I pronounce it. I stopped 8 milligrams of clonazepam cold turkey. Yeah, probably not good. What should I do if I have FND? Yeah, so stay tuned. I have an FND podcast I'm going to be doing with someone who's gone through FND. His wife has. So going through all the symptoms. We're going to be doing that in a couple weeks. So definitely stay tuned for that. Started Luvox 100 and last name is pronounced Dewan. I started 100 milligrams Luvox and didn't work that much, and up to 150, had horrible week. Should I push on? Yeah, I mean, sometimes you can slow down the taper too. So this is something I work with my patients, as well as I teach my students in my coaching academy, is that when you're titrating up a medication, you have a standard titration plan, like once every week or once every 2 weeks, but you have to adjust it based off of the patient's symptoms. So sometimes I found like patients can titrate faster than I predict. They just tolerate it really well. But then other times we have to go a little bit slower to titrate them up. And so in this case, if you went from 100 to 150, then like let's say I was advising one of my students, what I would tell them is that okay, slow down the taper, maybe go to 125 and hold it there for a while, and then go up. So that's what I would tell them instead. Which SSRI do you prefer for anxiety? Probably Zoloft. I think it's one of the best ones for it. People with bipolar gets worse with drinking. Yeah, I've had patients whose manic episodes have been triggered from drinking. So definitely need to avoid that. Best medicine for OCD, I would start with Luvox first, and then after starting with Luvox, then I would switch to clomipramine if the Luvox didn't work. Thoughts on Lexapro? Lexapro is a good starting choice for a lot of people. It is very, it tends to have less side effects than some of the others. I don't think it hits as hard, but I think that can be very helpful. So it's a good starting one. Do you think internal medicine doctors should prescribe multiple psych meds? I mean, yeah, if they're experienced enough to use them. Internal medicine, they really have a lot of specialty expertise, and different doctors choose different expertise they have. So it's up to each doctor's discretion to decide when they feel comfortable treating versus when they would like to refer. For example, as a psychiatrist, sometimes I prescribed birth control before. I prescribed thyroid medications. I prescribed GLP-1s, and so because I'm a physician, I'm able to do that. So just because someone is not in that specialty doesn't mean that they're not allowed to prescribe things if they know how to use them. What about thoughts on vortioxetine? So vortioxetine, that's one of the newer antidepressants, and I like it because it tends to have lesser side effects than some of these blatant SSRIs, because it tends to be what we call a serotonin modulator. So I found that being a serotonin modulator, it can target some serotonin receptors and control the amounts of serotonin receptors. NPs, yeah, so I'm a psychiatrist, but I coach NPs. So I run a nurse practitioner coaching program where I teach NPs clinical psychiatry and real world psychiatry. Do you think the anti-anxiety meds side effect stats are inflated due to the demographic it treats? Yeah, I do think that, especially with SSRIs, that some of these stats are a little bit inflated because people with anxiety perceive their side effects as being more severe. You perform ECT? No. On Lexapro 10 milligrams for 7 years, I started tapering. Also, we got 186 people in here, so definitely like this. Let's see if we can get to 2K likes. How to control weight on olanzapine. Yeah, so I actually I'm actually going to be giving a talk on this in my nurse practitioner coaching program as well. So teaching my providers. But essentially, I have a different hierarchy of doing it. First is always diet and lifestyle. So of course, that's number one. You control the diet you eat. So just make sure that you eat healthy, clean foods. So that's what I tell my providers to tell their patients. Second is adding metformin, because metformin's easy, it's cheap, and it's an easy way to mitigate some weight gain. Then third, I would consider, either a GLP-1, if the patient's insurance can afford it. If they can cover it, then that would be ideal. But if they cannot, then I would consider topiramate. That can be helpful for binge eating. Wellbutrin can be added, or Vyvanse can be added. What's your experience with Librax? I don't know what your Librax is. What's your daily routine with eating, drinking, exercising? Yeah, it says tune in for a luncheon live and you'll see. But I usually eat one meal a day, give or take, or like one small meal, one big meal. So for example, usually I'll have my standard meal. Hey Paul, good to see you. But today I'm having dinner, so I'm having dumplings today, and so I just had just a little bit of food this afternoon because I'm saving my calories for this evening, and then after that I'm gonna go work out. Actually, after that, we have a call in our coaching program about Caplyta. So an MSL from Caplyta is going to be speaking to my NP coaching community and educating us on it, on Caplyta as well. Can you talk about PANDAS? Yeah. So PANDAS is pediatric autoimmune neuro. I forgot what it stands for. Pediatric. Yeah, but anyway, PANDAS basically is like a strep infection. Oh, caused by strep. Yeah. So it's a strep infection that causes OCD, and it's present in a lot of kids. Some people don't believe in it. I believe in it, so I believe it's a thing. And the way to treat it is you have to test for strep antibodies and strep antigens, and if you find positive strep antibodies, especially acute antibodies, but sometimes chronic too, then you can treat it with antibiotics. So this is more like functional medicine stuff. Can GLP-1 be taken forever? Good question. Ideally not. I'm not a GLP-1 expert by any means, but generally you would take it until you have achieved the weight remission that you have had, and then the weight loss, then you'd probably lessen the dose. Or the ideal goal would be to learn how to take the GLP-1s until you're able to lose weight, and then figure out how to maintain it through diet and exercise. Awesome, thank you for sharing and thank you for liking. Okay, so if you're a provider here, say 1 and say what kind of provider you are. And if you're a patient, say 2, and just if you're a general everyday person, say 3. So I'm curious what the distribution is, the breakdown. 1, Paul, yes. Hey Maddie, good to see you. 2, 2, 3, 2. Yeah, 1 if you're a provider and say what kind. 2 if you're a patient. And 3 just like a everyday person who likes the stuff. Pre-med, 1, 3. Dylan Grange, nice. PMHNP, welcome. 3. Cherry, good to see you. Sherry, Kyle on mine, mental health coach, Paul, NP. Okay, looks like we got a good good mix in here. 3, 3, 3. Nice. Yeah, definitely ask your questions, by the way. Janelle, FNP, PMHNP, nice. 3, I love this stuff. I'm in Florida. Do the collaborating MD need to be a psychiatrist, or can it be internal medicine? So there's 2 ways to approach a collaborating MD. There's 1, if you just want someone to sign off on you, that's 1. But if you're a smart provider, what you would do is you would get a collaborating MD who's a psychiatrist, and that way you can actually discuss cases with them and get expert level guidance, because you want to be able to get that expert level guidance from your collaborator, right? If you're going to pay them, you might as well have access to their expertise. So that's where I'd recommend finding a psychiatrist for a collaborating physician. And I'm actually thinking about doing being a collaborating psychiatrist for my students too. I'm thinking of opening that up. I haven't done it yet because I've really been focused on building our coaching program, so I'd rather build that. And so now it's pretty much done. Now we're just picking up little pieces here and there. And child psychiatrist, nice. So we're picking up little pieces here and there, and but I'm considering becoming a collaborator soon. But so if you're part of the coaching program and you're interested in being a collaborating psych, or having me as a collaborating psych, definitely stay tuned for that, or send me a message. Yeah. What's the best treatment for OCD? I like to start with SSRIs first, high dose. You can add exposure response therapy. I always add on N-acetylcysteine with my SSRI treatments, so I do that, and then I'll switch over to clomipramine if I need to. Jupiter says a lot of clergy psychiatrists. Aren't you a child psychiatrist? Do bipolar have, there's only 8,000 of us in the country. What are signs you're taking too many side effects? Probably you have side effects. Alprazolam thoughts. Yeah, it's good for short-term anxiety, but long-term it's not the ideal. It also doesn't last very long. Does abruptly stop taking antidepressants also have mental effects? Yeah, you don't want to abruptly stop taking most medication, most psych meds, especially if you're taking them daily. Modafinil in a patient with cardiac, I mean, it's fine. You just have to monitor their EKG and their blood pressure and their lab values. This is something that I teach my students, is that it's always a risk-benefit calculation that you have to do with medication. Like, it's not just like, oh, they have a cardiac issue, therefore you can't use modafinil or stimulants. Like, no, you can. And this is why people come to us for expertise, because the guidelines are like, yeah, don't do it. But when you come to an expert, we have the expertise to know that, hey, this is good in this case, but not good in that case. So that's something I teach as well. Like, for example, so if someone has had some cardiac history, it doesn't mean that you can't use a stimulant or use a modafinil. You just have to be careful, especially if there are benefits for it. Where is your practice located? So I do mostly, I do all telehealth, but I do it remotely. So if you're interested in being a part of the practice, like if you want to become a patient, or if you want to become a patient, then consider taking. I have a free mental health quiz, and so you can take that mental health quiz on my bio, and you can see if if you meet criteria for any diagnoses. So learn more about if you have depression, anxiety, or ADHD. So definitely check that out. Is mental illness prevalent or popular? Both. I pressed something here, WTF, it happens. What are your thoughts on taking ashwagandha for anxiety? Yeah, one of my students actually just asked me this today. So ashwagandha is good for mild to moderate anxiety, and it's good for chronic anxiety. It's not like you take it and you feel better immediately, but it helps with anxiety over time. Valerie says, if I join the PMHNP this week, will I be able to catch up on all the info you've already shared? Yes, of course. So everything is recorded. So all the modules that I have on antipsychotics, antidepressants, psychiatric diagnoses, case reports, all of that's recorded for you to watch whenever. And I also record every single question and answer call we do. And so you have free access to that. For example, one of our members just posted that she will clean her house and then she'll listen to the Q&A calls. So we just had her last Q&A call yesterday. So we do those every week. Love your earrings. Thank you. I appreciate that. Is propranolol usually taken every day? Usually it's as needed, but some people do take it every day. How often is it too often to take propranolol for anxiety? I mean, like if you take it every day, then as long as your blood pressure is controlled, that's the most important thing. But a lot of patients, if they take propranolol every day, they might benefit from the XR, extended release. Do you practice by telehealth? Yeah, I do. So I do a lot of consults for patients, and sometimes patients who are not where I live, they'll still reach out to me for a consult, and I'll give them advice on their condition, how to treat it. And oftentimes they'll have their own local primary care doc do the prescribing. Chloe says, what about meds for BPD? I have 150 milligrams sertraline. Yeah, because sertraline helps with anxiety. It doesn't really help with some of the hallucinations or the mood lability. I like Seroquel a lot because I think it's good for mood stabilization, and it can help with some of the psychotic symptoms too. Abilify is also another good choice because of mood stabilization and for psychosis treatment. Do you drink tea or coffee? Very occasionally. What's your most prescribed med for GAD? Probably Prozac or Zoloft. Sertraline, yeah. Can I quit Seroquel after only 10 days of cold turkey? 25 milligrams. Yeah, that's a small dose. Yeah. If you haven't been on, this is something I also teach. This is like basic psychopharmacology that I teach as well. So, if you're able to come off a med safely, depends on how long you've been on it for, and how long you've been on it. and with how big the dose is. So for example, if the dose is really big and you've been on it for a while, then you should taper. But if the dose is small and you haven't been on it for a while, then it's easy to come off. Actually, let me get my pen because I want to write that down. That's a lesson I want to cover more in detail in my program. So I'll be right back. Awesome. Thank you for waiting. Thoughts on ketamine therapy? Yeah, it's good for treatment-resistant stuff. Like, let's say you tried a couple things and it didn't work. That's when I would consider something like that. Yeah, because a lot of it tends to be more like invasive, and people aren't, there's like levels to this shit. So you don't want to start with like something that's like higher tier. You start with something lower first, and then you kind of move up the ladders. Tapering meds. So I'm gonna make a lecture on that as well in our community. Come live in Mexico, it's much cheaper. Yeah, I'm sure. I'm sure it is. Yeah. What are long-term side effects of sertraline? Nausea, vomiting, those are like some of the shorter ones. Long-term is that tolerance can build. That's one of the ones. Sometimes people can have intimate dysfunction as well, long-term. Sometimes. Would you recommend MRI brain scan for, no, I wouldn't. Is Prozac, Trileptal, Zyprexa good for BPD? Prozac can be well. Zyprexa will probably cause a lot of weight gain, so it may not be the optimal choice. And then Trileptal is decent. It's a decent mood stabilizer. It's not the best. Best SSRI, my favorite's Prozac, because people can miss a dose on it and be fine. But I'm getting more into the newer ones too, like Trintellix and Vibrate. I find that they can be better tolerated a lot. They're just more expensive. How do you treat nightmares? Typically you use a medication called Prazosin. Are you using social workers in your practice? No, I do solo. I do a solo private practice, so I'm not interested in scaling that way. Like, I'm not trying to get a huge practice. That's not my goal. What for bipolar, schizophrenia? What about them? Histrionic personality disorder, mothers. I'm not sure what the question is. How to help with derealization. Check that you have the right diagnosis. Oftentimes, that can be related to something else. So you want to figure out what the underlying diagnosis is. I'm an MS2. Looking into psychiatry. Why do people joke about it? But being a neural doctor, one, who cares what other people think? Your life will get better the less you care about what other people think. Second, that's not really a thing anymore. People did in the past. Third, I think it's a lot of insecurity. Nowadays, like, psychiatry is respected just like in the old days, or just like any other medical specialty, whereas it wasn't in the old days. Fourth, they're just jealous that we get to work from home. Like, look, for me, it's a Tuesday afternoon. I haven't left my apartment today. So I think they're all just jealous. It sucks to be the surgeon or the internal medicine doc who has to show up at 6 a.m. to round on their patients. How can we as a country stop jailing mentally ill people? I think it starts with treatment of the mental illness first. Why are we girls so crazy? So estrogen, I think that's one thing, but it's also yin and yang, right? Guys are more logical, girls are more emotional, and that's why girls and guys need each other, because they complement each other. So when guys hang around, it's all just like logical kind of business talk, but girls give flavor, they give spice, they give enjoyment to life. But then if there's too much estrogen that's flowing around, that's when you have a lot of, backstabbing and toxicity and craziness and drama. But then, if too many guys around, things can be super boring. So that's where the mix, the yin and the yang come in. They mix that's why they need each other, right? Like, I could go to a concert or a museum by myself, but I'd rather go with a girl. I'd rather go out to dinner with a girl than go by myself. But I'd rather talk if I'm trying to talk like business talk, I'd rather talk with my boys, like, okay, how do we like, right, do business stuff together. So, or if I'm trying to like go fishing or something, right, or it's like be competitive, then I'd rather do that with my guy friends. But point being is that they complement each other. That's why you need the opposites to be together. Derealization. Yeah, so I would say first you want to check if it's the right diagnosis. Oftentimes people think they have derealization stuff, but it's really more trauma, and then they treat the trauma, and then things get better from there. Unless the guys are gay, then it's fine. Yeah, I'm just speaking for purely heterosexual. My roommate in med school was gay, and so we would go out to the gay bars together and drag shows and other things together. So I've experienced some of that side too. What would you recommend for an antidepressant for someone with epilepsy? You can use anything, nothing, probably Lamictal, to be honest, because Lamictal is also an anti-epileptic. Can anxiety give you chronic heartburn? Yes, it definitely can. What medication is good for chronic trauma? I would probably start with an SSRI. I used to treat a lot of trauma in the VA when I worked at the Veterans Affairs, so I would start with that. Okay, so yeah, let's see if you like this. Actually, we have 234 people here, so double tap this if you like this. Let's see if we can get to 10K likes. We're at 6,200 so far. What can cause weight loss? Weight loss is caused by a decrease in caloric intake compared to what you burn, and then weight gain is caused by increase in caloric intake compared to what you burn. Simple. It's a little bit more complex than that, but that's the foundation. Do you like fishing? Actually, no, I don't like fishing. That was just like a classic guy example. I'm more of a gamer. How is residency for you? Also, how would you rank your years of med school? They're so different, obviously like fourth year, best year of med school. Third year is probably the worst. Then it's probably fourth year, first year, second year, then third year. Third year is the hardest year by far. And then residency was fine. It wasn't too bad. Yeah, are you a med student or resident or something? I wish I had an issue so you could be my doc. LOL. No, I think it's good. It's probably better that you don't have an issue. Trust me, you don't want any issues. I've been taking Vyvanse 40 milligrams for 3 years. I think I'm eating a higher dose. Yeah, Vyvanse is like a good starting dose, 30, 40 milligrams. I've had patients do really well on 60. Why is my Lexapro not working? Started 12 days on 5 milligrams. Yeah, because it's 12 days. Antidepressants can take 4 to 6 weeks to work. Second, 5 milligrams is like a small starting dose. My psychiatrist is going to be giving me venlafaxine for social anxiety. Yeah, it can be helpful. I would just be cautious of how high you go sometimes. So what happens with venlafaxine is that starting dose, it's when you start it like at 37.5 or 75, it tends to be more serotonergic. But then as you get to above 150, then it becomes more norepinephrine, and sometimes that norepinephrine can be more stimulating. So you just want to make sure to avoid it being too stimulating if you're treating anxiety for it. I'm a med student going to second year. Nice. The second year is the step. For you, step one is pass-fail, so at least you have less stressful. For back in my day, it was not pass-fail. How does SSRI work for anxiety? But then if it's not pass-fail, it just makes third year harder. My grandson needs a therapist. He's 12. Can I wait till he's 13 so he doesn't have to see a I don't know what that means. I assume that means child psychiatrist. So pros and cons. I would ask you, how important is your grandson's mental health for you versus like waiting versus investing? See, with mental health, and I just did a live with a lady who had done TMS therapy, and she said insurance stopped covering it halfway, and she paid 10 grand out of pocket, but she said it completely changed her life when all the other meds didn't work for her. So mental health is an investment. Don't think about it like a cost. It's investment. You are literally investing in yourself. And just like you would invest in the stock market or your 401k, if you invest in yourself, you're going to make more money regardless. So it's better to invest in yourself rather than investing in some like financial thing, right? Like an IRA or whatever. Like, it's always better to invest in yourself. So If your grandson needs mental health help or therapy or psychiatry, it's always best to do it ASAP rather than waiting just to save some money. Yeah, and also, yeah, if you want to work with me as well too, best way to do that is just send me a message and we can see if we're a good fit. Yeah, we can book a consult, or you can check my bio and you can take. I have a free mental health quiz I just put up too, that you can take to see if you have the signs of depression, anxiety, or bipolar. Do you think I should stay with the doctor? Do you think I should get a doctor who treats my disorders, or stay with someone who treats everything? I'm not sure what that means, but generally you need specialists to treat specialist stuff. So like, if you have one doctor who treats everything, they probably aren't the best at everything either. Like I wouldn't have a regular doctor treating my cancer. Is it possible to live a successful life with schizophrenia? Of course, of course. Anything's possible. If you believe it's possible, it's possible. So there was people. I remember when I was in residency, we had this kid, 22-year-old kid, and he would go around to the med school every year and give a talk on his journey of schizophrenia and how he got better from clozapine. Also, yeah, we got 200 people here, so definitely like this. Let's see if we can get to 10K likes. See if we can get to 10K likes. Why do some doctors gaslight you saying, sorry, I made a mistake, whatever? Do they get fired? I mean, yeah, you can get fired. You can think that the patient might get upset. You don't want to disrupt the patient's thing. It's hard to say. Doctors are people just like anyone else. So that's kind of like saying, why does the server get upset when the order's wrong, right? Some servers will be gracious about it, whereas others might lose their shit. So they're people just like anyone else. Any advice for someone who blew 5 figures? Yeah, blow less next time. Is it normal for Vyvanse to make me euphoric? It's not normal, so the dose might be a little bit too high. If I'm ever in New York, would love to meet you, doctor. Yeah, so Paul, if you want to connect, best way to do that is through our PMHNP coaching program. So because we have live calls every week in our program, and I'm actually thinking about organizing a meetup because we have a lot of people in the New York, New Jersey area. So I'm thinking about organizing a meetup for our students as well too. So if that interests you, like you want to be a part of the community, then I would definitely look at joining our coaching program. What's your thoughts on paliperidone for schizophrenia? So paliperidone in Invega, it's pretty solid. It works well. It's got a nice long-acting injectable, so that's nice as well too. I'm in Michigan. Yeah, I'm actually from Michigan. My family lives in Michigan. I did my residency in Michigan as well too. So maybe I'll do a Michigan meetup once, or like a Midwest meetup once I'm there. Is your coaching inclusive of masculinity-based MH work? I'm not sure what that means. Like I coach psychiatric mental health nurse practitioners, PMHNPs, on psychiatry. So it's not really like a masculine or feminine thing. Like I think we have like 3/4 women in our program, so I'm not sure what that means. Is Lexapro good for anxiety? Yeah. Hello, yes. Did you have any braces in the past? Yeah, I had some braces in the past, back in the old days, back in the high school days, but not anymore. Thankfully, we got rid of that. I just keep getting the same thing, get some hobbies. Yeah, I mean, you got to get out there, right? Like, fortune favors the bold. Life rewards the person who takes action. Touch grass, yeah. Is matcha okay to drink if one has OCD? Yeah, matcha's fine. Matcha tends to be a lot more calm. Do you do the test for ADHD? There's no test for ADHD. It's by a clinical assessment. So if you want to do a quick clinical quiz to find out more, especially if you have signs of ADHD, you can check that out in my bio too, and you can take our free mental health quiz I have. Also, we're at 9,400 likes. Let's see if we can get to 10K. Let's see if we can get to 10K likes. We're so close. We are like literally right there. So let's see if we can make it there. .6, nice. Yeah, just double tap to like it. Man, 10 out of 10 program. Appreciate it, the Curious Legend. Thank you. Wow, these comments are scrolling so fast. I'm gonna keep tapping into my pancakes are done. Oh, I love that. Yeah. Okay, we're at 11K. We're at 12K. Awesome, awesome. Do you ever get back to Michigan? Yeah, I usually go every couple months. The last time I was there, I was visiting my parents because I was working on my coaching program, and so I said, you know what, I need to get away from New York and get away from all these distractions and just work. So I stayed there for about 2 months, and then I worked on my program as well. I'm near the east side area, like Canton, Livonia, uh, Farmington Hills, Bloomfield, like that area. So that's where I was staying. So I think I might, if I'm ever there next, we have some students by the Midwest. And so I might do a PMHNP meetup there too for our students in the Midwest area. As a psych, lithium is not a last ditch effort for bipolar. I don't know where you heard that. Bro's got more than one phone. Red flag, red flag, red flag. What do you know about transgenerational trauma? Yeah, so I think trauma passes down genetically, like there's genetic memories. And I think that's an evolutionary feature. So for example, if my ancestor had a big traumatic experience from a saber-toothed tiger, then I'm supposed to know that, hey, I need to be scared of saber-toothed tigers so I can stay alive. So that's why I think that's the mechanism for trauma passing down. Saffron has been shown, it's helpful for mild anxiety and depression, but when you get to more severe stuff, that's when it's hard. Is it bad if I don't sleep for 10 days and only nap? Yeah, I'm a huge believer in long-term continuous sleep, 8 to 9 hours per night. Dearborn Heights, Michigan here. Nice, nice. Why are people less functional today despite receiving more mental health care? Well, there's also more need as well too, and there's also more awareness of it. Back in the day, people just drank their problems away. Like for example, in India, there's a big thing where like families or kids would have mental health conditions, especially stuff like schizophrenia and bipolar, and just wouldn't talk about it. Like they would just keep the kids hidden. Best advice on driving again with anxiety? Yeah, you have to get exposure. Get exposure therapy. Like you start exposing yourself slowly to the situation. How do I cope with bullying? I mean, level yourself up, get away from the environment, stand up to the person. Where'd you go to college? I went to college at the University of Alabama at Birmingham. I'm worried about my love life. I'm single. I don't know whether I can get someone who I can love and love me back. Yeah, the only solution is to level up. I mean, let's say you're playing a video game and a boss beats you. Well, when a boss defeats you, you literally have two options. Your options are A, to beat the boss, or to beat the boss, or to quit playing. And so either, you can quit playing, or you can level up and you can fight the boss again. So if you're worried about not finding someone, you gotta level up and you gotta get out there. Like that's the only solution. Like there's literally no other option. I'm in Southeast Michigan, nice. A doctor told me I was in a catatonic state. It just means that you're probably not moving. ADHD meds, is it okay if take if you have mitral valve prolapse? Yeah, I would probably just keep the dosage lower. All right, let's see. Okay, we got 232 people here. Okay, let's see. Let's see. Let's see. Say 1 if you're a provider, and say 2 if you're a patient, and say 3 if you're like just an everyday person listening to this. I'm curious what our breakdown is. We have 249 people in here, and then what kind of provider you are, like a PMHNP, MD, PA, etc., etc. 2, 3. We got 3s, 1 PMHNPs, psychology professor, 2s, RN, emergency medicine, NP, does crisis psych. Nice. 1, 2, 1. I want to weigh in. Yeah, go ahead. 1, Valerie. Nice, good to see you. RN, okay. One PMHNP, okay. We got a good mix here. 259, 3 with the 2, Psych ED, social worker. Nice. Do you have knowledge in Wellbutrin helping with depression and weight loss? Yes, of course. It helps with both. Definitely does both things. As a social worker, I need your videos. Thank you. I'm glad that they're helpful. Yeah, I think a lot of providers are really finding our videos helpful too. And so a lot of them are actually from my NP coaching program. So every week I do a Q&A call with their program. And for example, we did one yesterday. And so I'll upload clips from the program online. And so that's been really helpful too, because that way I can teach my PMHNP students, but then, you get to get value from it as well. But then they will ask me questions directly. So like they'll ask me questions about cases they have or clinical questions, and then we'll answer them and discuss it. How does fluoxetine target and relieve OCD? So in OCD, there's a lot of recurrent thoughts that are happening, a lot of glutaminergic activity, and basically a lot of repetitive thoughts. And so the serotonin for SSRIs to help calm that down. I've been on 300 milligrams of Wellbutrin for 1.5 months. I already lost the rip. I've been on 300 milligrams of Wellbutrin for 1.5 months, trying to get used to it. Yeah, it can take some time. Small linear, I'm not even sure what that means. What cases interest you the most? I like integrative psych, so I do a lot of integrative psychiatry. So there's a lot of cases where I don't just use medications, but I use supplements, I use therapy, I do Lyme testing, mold testing, genetic testing, pretty much combining all the different parts of mental health treatment, medical testing, lab work, into the treatment. Because a lot of psychs, what they'll do, they'll just prescribe meds, and I like to incorporate supplements, like functional lab testing, like magnesium and zinc and thyroid, detailed thyroid stuff, infectious testing, like incorporating all that stuff. My OCD gets worse at night. I'm just on meds, but it affects my sleep time. Do you cover some integrative psychiatry in your PMHNP group? I'm very interested in learning more. Yes. So we have a whole module on integrative psychiatry. So I have a whole bunch of supplements that I'm teaching as well. I just did a couple modules on how to prevent weight gain, the fundamentals of weight gain, weight loss, intermittent fasting. I've covered supplements like omega-3s, lion's mane, magnesium, zinc. I'm doing a new module now on integrative lab testing. Basically, if you see a patient, what labs to order to test integratively. For example, red blood cell magnesium, zinc, ordering vitamin D, ordering thyroid, ordering omega checks. If you want to go detailed lab testing, then ordering cortisol, for example, for functional stuff. For PANDAS assessment, ordering strep antibodies. So doing the whole functional assessment, functional medicine teaching as well too. Basically, my goal is to make it the best Psych NP education program in the country. Like, that's my goal. And because I think that a lot of you, the education system is shafting you, like they're just taking your money and not fully treating you or training you. It's either the programs or the collaborators or the preceptors, like they're just not training you, they're just taking your money. And so it's really unfortunate because now you get pushed out in a system that's expecting you to perform and to do really well, but or they might have you see like 20-30 patients a day, just crank out patients, but you may be not feeling confident, you might be feeling imposter syndrome, you might be feeling like you're in over your head. So I want to help you overcome a lot of those mental beliefs that you have, through the right education. Because I was fortunate, I had good education. Like, as a psychiatrist, we went through medical school, residency, and fellowship. So it's nice because like for us, the pipeline is very straightforward, and it's like you just follow the steps. But for you, like, I had an NP message me, and she was like, "Hey, I need a preceptor," and I was like, "What? Your school doesn't provide you preceptors? You literally have to find your own preceptor? Like, that's so. Your school should be taking care of that." So that was a sign for me that okay, the education system is not the same, and they are taking advantage of you, just taking your money. What about physician assistant? Yeah, so I think PAs fare a little bit better because their education is more standardized, so it follows the medical model. So that's the better part about it. But I think that the educational stuff still applies, and that the PA education is not the same as a psychiatric residency and fellowship. So you have to make sure that you get good mentors in order to properly learn the depths of psychiatry. I've done 5 years of residency and fellowship. This is my 6th year of practicing, and like I still don't know everything. I'm still learning stuff. So if I feel this way and I have the humility to say that, then someone who has like a fraction of that, it's arrogance to think that you know everything and you don't need any help. But that's why we have some PAs in our program as well, actually, because they also wanted the education, the psychiatric education. Opinion on contrast therapy as a tool to help the patient's mental health? I mean, sure. The way that I think about mental health and stuff is that imagine if you're playing a video game. So in a video game, you have a skill tree, and in the skill tree, let's say you might have your attack skill tree, you might have your defense skill tree, you might have like a stealth skill tree, you might have a tools, weapon skill tree. So there are different skill trees, and there are different skill trees that you can level up in. And then as you level up in the skill trees, it makes the game easier and the enemies of the game easier. So with the different skill trees, right? So you can approach, meds could be one skill tree that you approach mental health with. Therapy is another. Supplements are another. Contrast therapy like cold plunge and sauna, that can be another. So there's just different skill trees to approach different issues. Just like if you're fighting different bosses in a game, you would use different weapons. If you're playing Pokemon, some Pokemon are easier to defeat than others are based on what you choose. So yeah. I think Mo PA says, I agree with you, I'm a PA. Yeah, and at the end of the day, we all work together to help the patient. It's all a collaborative effort. Like I've gotten a lot of shit from other doctors who are like, hey, you're a sellout, you're selling out to medicine, you're disgrace to the field of medicine because you're helping NPs and helping mid-levels. Like, you're the reason why medicine's going downhill. And I'm like, well, we're all working together. So it makes more sense for us to all work together and collaborate, and for me to share my knowledge rather than me being part of the problem and just talking shit behind like NP's backs. Did you used to RuneScape? Yeah, I played some RuneScape back in the day, yeah. Back in the day. Have you watched Grey Gardens? No, I've never watched Grey Gardens. I watched White Lotus recently. That's the most recent show I've seen. "20-year first responder, think PTSD is getting to me." Yeah, PTSD is definitely a thing. Sorry, if you're a first responder, yeah, because you see a lot of stuff. So you definitely want to make sure you get that addressed. Disdain for mid-levels is more self-entitlement, self-interest, they're worried about scope encroachment. Yeah, but what I always say about scope creep is like, okay, look out here. Like, just look out here. Do you see how many patients there are? Like, do you see how much activity there is? Like, there's more than enough work, more than enough people for all of us combined to see and to work in. So scope encroachment, all of that, like that's literally all that means is that the future's catching up and you're not leveling up. Like that's all it means. So that's kind of like saying AI, or that's like when the automobile came out, the buggy owners being like, oh, scope encroachment, my horse is scope encroachment. Well, yeah. So either you learn how to level up and you figure out how to drive a car and operate a car, or you get left behind. It's the same thing with like AI. People are like, oh, AI is gonna take your job, blah blah blah. I'm like, no, nonsense. AI is gonna be a tool that we use. So if you don't know how to use it, yes, you'll get left behind. Or let's think about the businesses, like brick and mortar businesses, and Google came out. Now, if you didn't know how to use Google, then you get left behind because now people aren't able to Google search you, and that's how people find businesses. Whereas before the internet, it was all word of mouth and like location. Point being is that there's always going to be change and there's always going to be scope creep in any field. So either you, I mean, you can either bitch and complain, quit playing the game, or you level up and you move on. Like you figure it out. So yeah, that's my views on scope creep. Escitalopram 20 milligram for anxiety and mood. Yeah, it's a solid dose. Empty mind psychosis. I don't know what that means. Thanks for your help and acknowledgement, and PAs and MPs are part of the team. Yeah, exactly. Like I never got the hate or the judgment, but whatever. I think, there's losers are gonna lose and winners are always gonna win. So like that's what it always comes down to. So you just decide when you like how you want to approach things. And yeah, I mean that's just how I think about life. And so like that's why my coaching academy is called Level Up Psych Academy, because I want to help Psych and Peace level up. That's why my private practice is called Level Up Psych, because I think that life is a video game, and that the best way to beat a video game and the best way to have fun is to keep on leveling up and progressing. I have a nice Persian girl too. Okay, well, I'm married to the game, so that's the most important thing. Every time I try to learn, I feel asleep and eventually sleep. I don't know what that's. Every time I try to learn, I fall asleep. Yeah, make sure you're getting a good night of sleep every night, so that way you can focus. Make sure your diet's clean and we're not eating the trash that modern society throws at us. Your views on effects are good. It's solid. It's a hard-hitting antidepressant, but it needs careful tapering. You can't just come off of it. Also, we're at 15K likes here. Let's see if we can get to 20K likes. Let's see if we can get to 20K likes. We're at 15K right now. Best way to combat heat intolerances with meds. I mean, yeah, that can happen. I mean, lowering the dose, AC. If you want other supplements that can help, magnesium can be calming, or L-theanine. Eating cold foods, using clonidine or guanfacine. There's different options. When someone makes you irritated, walk away. Yeah, I mean, that's true. There's no reason to, because remember with arguments, it's like one person escalates and the other person escalates and the other person escalates. But if one person is escalating and the other person's here, like that one other person can only go so far. Like no one just yells and the other person stays quiet. It's usually like they kind of go and they go and they go and they go. How do you feel about Invega for schizoaffective? It's great. It's a good med. Invega is also nice because it's got a long-acting injectable that you don't need oral overlap for. Basically, you can just start it immediately. So, yeah, if you're a provider, if you've ever used a long-acting injectable, definitely keep that one in mind. I have bipolar 1 and take Depakote. Yeah, Depakote's a solid med for bipolar 1 mania. Just do not get pregnant on it by any means. That's all. Just if you plan on getting pregnant or whatever, then definitely talk about it with your provider. What do you think about nurse practitioners in psychiatry? Yeah, you just missed my rant on it. But I run a coaching program where I teach nurse practitioners psychiatry and how to have clinical confidence with real world psych. And I think that a lot of other people are, they have a scarcity mentality and they get afraid of NPs and scope creep and all that. But in reality, we're all just working together. What's the best second-gen AP for bipolar that can focus on calming agitation? Probably olanzapine. Why LMAO? Because Depakote can cause birth defects in the baby. Do you feel that TMS? Well, dang, it works for my BP1. Why don't you start trying for little one? Well, I'm glad you came to this at the right time. Right time. I would definitely discuss with your psychiatrist and definitely plan it. How rigorous is a psychological training for psychiatrists? Depends. Some people pursue more than others in residency. What are your thoughts on TMS? It's a good option. A lot of patients have really good results with it. You just have to do it continuously for a while. Like, I just did an interview on TMS, so there's going to be content coming out, so check that out for sure. I had an interview with a patient on TMS, so definitely look at that. And she'll share her thoughts. Is it okay to take modafinil more than prescribed just to get stuff done? I mean, I can't tell you how to take stuff, like it's only with your provider, but maybe it's time for a dosage increase then if you find you're needing it more. Never take Depakote while pregnant, right? PMHNP Coaching, is this the same as a collaborating physician? No. So I have a coaching program where I teach PMHNP psychiatry, so it's much more than a collaborating. A collaborating psych just takes your money and like signs off on papers. Like I actually teach psychiatric diagnoses, psychopharm, case reports. We do weekly Q&A calls, integrative psych, integrative labs, all of that. Learning how to become an outstanding psychiatric provider, a full, well-rounded psych provider, developing clinical confidence and getting over imposter syndrome. Like that's the goal of the program. Basically the best education program for psych NPs in the country. That's the goal. So if that interests you, definitely send me a message. Yeah. And I can send you some more info on it. Awesome, we should connect. I hire many NPs and could use this. Yeah, send me a message. Yeah, we can collab for sure. Tips on how to remember all the disorders in DSM-5. I'm reading for license, but having a long time. Yeah, think about actual patients. Think about actual patients that you've had, and that correlate the symptoms of the DSM-5 to them, because it's a lot easier to remember a patient than just stuff. What are the best meds for BPD? I like the mood stabilizers, Lamictal and Seroquel. I mean, Seroquel is an antipsychotic, but it's used as a mood stabilizer. Do you actually have a job? No, I just cosplay. I just role play, man. If I have anxiety for college, do you think it's good to take anxiety meds even though they are addictive? Well, SSRIs aren't addictive. You're always online. Aren't you always online? Because you're watching me be online. What are your thoughts on lithium orotate? Thinking of buying it? There's some nutritional data for it. It can be useful for maybe like mild bipolar, mild depression. Lithium orotate doesn't replace like actual lithium carbonate, for example, for bipolar treatment. But if you have super mild case and you're clean eating and stuff, then it could be helpful. Learn a language with toddlers. Okay, binge eating, binge purge. Why won't people take advice? That's a good one. I have two thoughts on that. One is that most advice, quite frankly, doesn't apply to most people. So, just because you give me advice doesn't mean I'm implied to take it. But secondly, advice is usually people give advice when the other person doesn't want it. So the only way for advice to be helpful is if the other person actually wants advice and asks for it. Because if I just give you advice, you're gonna be like, F you, right? So you have to actually want the advice and ask for it. And then the second thing, or the third thing, is that for anyone to make a change in life, there has to be enough pain in their life. So let's say, for example, I'll tell you a story. So I had this patient who had had a bunch of heart attacks. Like he had 3 heart attacks, and so I was doing my internal medicine rotation, and block this guy real quick. Yeah, so I was doing my internal medicine rotation, and then I had this patient I was seeing, and he had 3 heart attacks. And so I was seeing him after his 3rd one. He was in the hospital. And when I saw this guy, he knew that the smoking was causing him a heart attack. He was smoking a pack a day. And I was like, well, the smoking, it's, what are your thoughts on it? And he was like, yeah, but, I'm too old. I don't want to quit, blah, 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 like stuff like that. And then I just started asking about his life. And he said he had a granddaughter. And then I asked him, cool, what's going on with her? And he's like, oh yeah, she's about to get married in 6 months. And I was like, oh, that's cool. Are you gonna see the wedding? Or are you gonna be able to make it to the wedding? And then the guy, he stops and he starts thinking, and he's like, huh, am I gonna be able to make it to the wedding? And so I leave him there, and then fast forward a week later, he comes for his clinic follow-up, and he comes back and he's like, he quit smoking. He said he quit smoking cold turkey. And the reason was because he realized that, wow, he wanted to make it to his granddaughter's wedding. And so in that case, the pain of not being able to make it was more and more than enough, was like that cusp to help him quit smoking. So, everyone had told him, hey, just stop smoking, it's gonna cause like heart attacks. Like, okay, whatever. Like, he already knew that. But yeah, so that's a trick called motivational interviewing. That's a very standard treatment like modality that psych providers use. But in that case, he had to experience and feel that pain of missing his granddaughter's wedding. So that's the thing. So just same thing with like if I tell you not to touch the stove, you might say whatever, and you'll touch the stove until you feel the pain of touching the stove, and then you stop. I'm scared to take medication for OCD. What do I do? Think about the pain that it's causing. So it's literally what I'm just saying, because the only way that you'll change is if the pain of staying the same is worse than the pain of changing. So think about all the pain that the OCD is causing you, and that can help you be motivated to take medication for it. How often do you do it? I don't do it very often because I think it suppresses your natural urge and drive. What medication would you prescribe for hearing voices on olanzapine? I mean, clozapine, risperidone, Haldol. Why do people like to feel like they're victims? Because it's very comforting and it's a lot easier to feel and blame other people than it is to take action. What does the plastic around my glasses do? So this is for dry eye. Which medication is the best for anxiety? I mean, SSRIs are generally good to start with, but there's different options that are used. So, okay, we're at 16K likes here. Let's see if we can get to 20K. So double tap this if we want to get to 20K. We're at 16K so far. Let's see if we can make it to 20. 17, nice, yeah. Meds for binge eating, topiramate, and Vyvanse. Those are good choices. Metformin 2/4, GABA agonists. Can seizures at night be related to mental health? Maybe. I mean, it's hard to say without an evaluation. I'm on 500 milligrams of Seroquel and anxious. What should I add? I'm on Seroquel. Seroquel is not really used for anxiety. It's used more for psychosis and sleep. My child is going to school for psychiatry at UAB. Any advice for going in this field? So I think you mean psychology. Psychiatry is it's a medical specialty, and so yeah, UAB. That's so funny. I went to UAB for undergrad. I never did psychology. I took biology, but definitely, yeah, just enjoy your time there. Make sure that her grades are good, and then enjoy the rest of your time. College is very it's a life-forming experience. How to overcome childhood trauma. I mean, you just EMDR, long-term therapy, forgiveness. That's a big one. Oftentimes, people hold on to hurt and hate longer than they need to. I have dry eye, and my optometrist never recommended having enclosed glasses to help. Yeah, it's because, I mean, there's two reasons. One, I mean, the easiest one is they just don't know about it. Like, my optometrist didn't know either. I only found out from my ophthalmologist. The second is that, of course, they'll probably want you to be doing for example, I was doing this thing called IPL, so I would be coming back to the clinic every couple of weeks to do that. So they want you to do that, so that way you stay a patient, right? So they want you to do IPL, or they want you to take meds so that we keep on following up. With these glasses, I got off all my psych meds. My dry eye meds. They've been the best thing I've ever done. These glasses have, and I don't do IPL anymore. I mean, they look funky, but I'm totally cool with it. Opinions on polypharmacy. I mean, it's obviously not good, but sometimes you have to. For example, I just created a lecture in my coaching program called on augmentation, because sometimes in psychiatry you have to do what's called augmentation, and you have to augment a med. So like, let's say you're treating depression and the treatment's not fully working, then you have to add in what's called augmenting agents to help treat the depression. And so that's where a case where polypharmacy is helpful, because it can help you with the depression. It can help you treat the patient with depression, but you have to do it right. It's not like you just add on meds. You have to know how to use multiple medications together correctly. And so this is what separates a psychiatric provider from a general person, a GP, because we're the experts in this region, so we have to know how to do multiple psych meds together. So so if you're really interested in learning that stuff too, if you're a provider, you really want to learn the complex psychopharmacology, augmentation, how to taper, etc., then definitely look at joining our coaching program as well. Do you think saffron works for OCD? Nah, I don't think it's strong enough. Would you recommend modafinil as an adjunct for mirtazapine? You can. They just might conflict. How much RN experience do you have? So before getting your NP, so I'm not an NP, I'm a psychiatrist. So I went through med school, but I coach NP. So I have a PMHNP coaching program where I coach NPs. So what I advise people is that, okay, you want to make sure that you have at least some experience. I mean, you can do direct entry, but if you get some experience before doing direct entry, it could be really helpful, because one, you can see if the field's really for you. Second, you can take that floor experience and then translate it over to provider experience. Whereas if you just go down that pathway, you won't have that much floor experience. And then third, it'll make learning psych easier, because you'll have experience like using those medications, like actually administering them with the patient. So I think those are the advantages of taking some clinical stuff before. Sajang123 says, I want to join PMHNP coaching program. Okay, perfect. So best way to join, you can send me a message or check it out in my bio. That is the best way to join. Nice. We got 200 people here. Okay, let's see if we can get to 20K likes. We're so close. So double tap if you're finding this helpful and valuable. We're at 18K. Let's see if we can get to 20K. How do I sign up? Yeah, just send me a message. That's the best way. Send me a message or check it out in my bio. Either or, you can see the link to sign up. And I'm just checking my bio. Yeah, it's right there. So you can see the link to sign up. Does TMS therapy help with OCD? Yeah, I can. Yeah, I definitely can. I just didn't. I'm gonna be releasing clips of a patient interview I did who had TMS, and so she shares her experience with it. Do you think medication is the only way to recover from DPDR? No, I think finding out the underlying cause is more helpful, like if there's trauma or something. How'd you end up in psych? Yeah, that was always the goal. I knew I wanted to be a psychiatrist. Like when I went to med school, it was either psych or family medicine for me, and like I was pretty set on psych. How to get bipolar and manic person to accept diagnosis? You might have to do forced treatment for them, unfortunately, because that's a bipolar's yeah. They might have to get a court order, especially if they're a danger to themselves. I have a small history of brain lesion and depression. Do I need to see a psychiatrist? Yeah, I would. Is mental health industry recession proof? Yeah, I mean, everything is recession proof if you know how to do it right. Have you gotten an evaluation? I found out SSRIs don't metabolize in my body. From GeneSight, that's not true. They just metabolize slowly. GeneSight is overrated. You know, just because they're in the red doesn't mean it doesn't work. Are you an NP or MD? You can look at my name and judge the credentials for yourself. How can I discuss ADHD with my psych? You just talk about it. Like you just say, hey, I suspect this. Hey, I go to USACOM and want to be a psychiatrist. Nice. What year are you at USACOM? And are the other psych faculty there? Is Dr. Sandra Parks there? Is Dr. Engerizer still there? I know some of the other older faculty left during, like, back in my day. I'm finishing my bachelor in psych, looking for my first job. Well, good luck. So no on GeneSight. No, I just think it's overrated. I'm not saying no on it, but you have to know it doesn't mean that no SSRIs are good for you. All GeneSight means is that your metabolism might be a little bit slower. Why does it say PMHNP? Is that primary mental health nurse practitioner? Yeah, so I am a psychiatrist, MD, but I have a coaching program where I coach psychiatric NPs. So that is the distinction. My son is currently on his 10th session, but doesn't see much of any improvement. Yeah, the patient I interviewed says she started noticing improvement on session 19. That's when she really started noticing it. Spammers. What medication is better for DPDR? Can I talk with you in California? Unfortunately, I don't have a California license. Look behind you, I'm spying on you with the drone. Oh, okay. I'm just an M2, just past step 2. Oh, nice, you're starting step 3 pretty soon. Just past step. Yeah, are any of the old faculty still there? Like Engerizer. I had Dr. Kinjal Galani, she was my attending. What made you decide to start coaching PMHNPs? I'm excited to see MDs who are willing to coach. Oh, wait. Yeah, good question. So pretty much I was doing these lives, and so I had a lot of PMHNPs come on the live, and they said, hey, I'm not learning stuff, asking psych questions like this. My program's not teaching me, my preceptor's not teaching me, my collaborator's not teaching me. So I was getting all these questions. And so I was like, that's, I didn't realize how much of a problem this was. Because mainly the psychiatrists that I've seen are, they just shit talk PMHNPs, but they're just like, oh yeah, their education is bad, or they don't know what they're doing, etc. Like, that's all I've seen. But then what I saw when I went on live was that, okay, people are actually recognizing that, yeah, sure, there's a problem, but they want help. Like, they're seeking it out. It's not like they're just arrogant about their practice and education. Like, the PMHNPs want help. Actually, I would say more than a lot of MDs. I think a lot of MDs have arrogance. But so I saw that, and I saw that it just kept happening and happening. I was like, okay, I think I need to do something about this. And so I started a program, and then we had 10 people join in the first 2 or 3 days. So I was like, holy crap, things are like, there's definitely a need for this, definitely a demand. And so I said, you know what, like, I'm gonna go all in. And so, I moved to my parents' house for a couple months and literally just focused on building the coaching program to make it the best psych educational program that I can in the country. Like, basically downloading all the info I have from psych residency and fellowship into the program, like all the knowledge that I've accumulated and have been continuing to accumulate. So that's been my goal. So literally, like, I left New York for a couple months, and I was like, okay, I just need to focus and go all in on this. And so I did, and now we've grown. We just crossed 150 members yesterday, so we're definitely growing a lot. And so if you're, so people are joining and people are staying. So definitely, if you're a PMHNP, you're a provider, you're tired of not feeling confident, you're tired of imposter syndrome, you don't want patients to disrespect you, you don't want other providers to disrespect you, because here's the truth, that a lot of psychiatrists, psych providers look down on PMHNPs. And they're just like, oh, they don't know anything. Whereas my view is that, okay, I would rather we all work together to help out the patient rather than be worrying about like scope creep and stuff, because like, look how much stuff there is here. So like, there's more than enough patients for all of us to see people combined. So yeah, so that's why I'm like, okay, I can bitch and complain like most losers do, or I can be part of the solution and we can all work together. So that's how I started the coaching program for PMHNPs. Where'd you go to med school? I went to University of South Alabama, and I did residency at Western Michigan. Oh, no, we crossed 20K lives. That's awesome. I learned so much from MDs at school that I'd never learned at school. I appreciate exactly. So that's something I teach in our program as well. Is that there's a difference between textbook psychiatry and real world psychiatry. Textbook psychiatry is like, oh, if they meet some criteria for diagnosis, then you diagnose them. Real world psychiatry is like, well, actually, there was this patient I had who had conduct disorder, but when I diagnosed them, it caused a whole bunch of problems with the school, and now the kid got kicked out of school, and now the family got really mad, and then the practice I was working at got really mad, and then the patient was delayed in their education for 3 months, and then they had to repeat the year because of school stuff. They had to get a separate evaluation. And so that's the real world would be like, well, okay, was it worth putting in that diagnosis in the chart when I just suspected it, but not fully, if it caused all this problems for the patient? That's the real world. Or how do you keep a patient in your private practice? Or like, how do you diagnose someone? Or how do you help them get over some kind of problem that they have, or some kind of like addiction that they have? Like, that's the real world stuff versus like just textbook. So that's something I pride myself in too, is that we go over real world psychiatry prescribing and treatment. The neurologist said I have query MS after MRI. Is it related to my history of depression? Yeah, MS, multiple sclerosis, can cause depression. Because if you think about it, multiple sclerosis is literally lesions in your brain. And so if you have lesions in your brain, depression is a symptom of problems in the brain. So, of course. Can anxiety prevent you from walking? Yeah, maybe it's like a functional neurologic disorder. How can I tell my therapist about SH? I mean, you're telling me right now, right? So if you can tell me, you can tell your therapist. Does adult onset ADHD in women exist? Sometimes, yeah, it can. I think it's more that it's like undiagnosed. There's signs going on in the youth, and then they get worse as things escalate, or they get older, or demands increase. For example, a lot of people get diagnosed in med school because the demands get very intense. So if you want to get an ADHD evaluation or a second opinion, you can check out my bio. You can I have a free mental health quiz that I do, and so you can get your ADHD assessment there too. See if you have some of the criteria for it. Do you do any clinical examination? I mean, yeah, like everything's a clinical examination. Me talking to the patient, doing a mental status exam is what we call a clinical examination. Well, Wellbutrin 14 days in. Insomnia so bad. Yes, I mean, it's hard to say. You have to make that decision with your doc. Hopefully the insomnia goes away. Make sure to just take it first thing in the morning. That's the most important thing. Take it in the morning, and if you need something for sleep, then take it for sleep too. Excuse me. Is New York worth living in? Yeah, I mean, I've lived here for 3 years. I'm going to continue living here for a while. I'm about to go out for dinner. So, yeah, I have low energy and low motivation. I mean, you just got to work on it, right? Like, you got to find the solutions to it. Remember, like, talking about problems doesn't help you solve the problem. It just helps you kind of stay stuck. How to differentiate between someone has ADHD or CPTSD? I mean, like, CPTSD is more like there's trauma symptoms with that. There's flashbacks. There's significant trauma history. ADHD is more just like focus impulsivity problems. Like, that's the difference there. Treatment for BPD. I mean, there's different. Some people want medication. Some people want DBT. Some people want more like family kind of stuff. They want more holistic. So it just depends. You've sent me a message. Okay, awesome. I'll check it out once I finish the live. Do you need a roommate? No, I don't need no roommate. Yeah, I'm good. Why do I sleep soon much when I'm not depressed? 14 hours. Maybe you're trying to compensate for lack of sleep before. Maybe your sleep is not high quality. Maybe you need a sleep assessment. So I always recommend people sleep 9. I mean, I sleep 8 to 10 hours a night. Like, that's where I feel the best. And I judge how good of a sleep I get is when I wake up in the next morning, and I wake up relaxed, feeling happy, and not needing any caffeine. How do you feel about transitioning in the future to the alternative model for PDs? I don't know what that means. Alternative model for PDs. What medicine for bipolar is safe for pregnancy? Usually the antipsychotics. Those are the go-to. How do you manage gender dysphoria? I don't treat gender dysphoria. I'm not an expert in that. Do you think FMT is effective for mental health? No, I don't really. I mean, I think it can be, but it's definitely a out there procedure. Like, I wouldn't recommend it for everyone. Do you do electroconvulsive therapy? No, I do not. No. Okay, we're probably gonna have about like 5 more minutes ish because I gotta get rolling. I'm going to dinner, so yeah. What's PMHNP? So a psychiatric mental health nurse practitioner. That's what it is. So it's a type of provider. Basically, it's an NP, nurse practitioner, who decides to get psychiatric mental health certification. Thoughts on niacin? I mean, it's a supplement. You take it if you have a deficiency, but it's not going to really help you if you don't. I have PTSD from family members, unaliving of ADHD. Awesome. Have you worked with anyone who has fear of driving over bridges? Yeah, I have a patient who has that fear as well. So we did exposure therapy, and that was helpful for her. And then as well as we did some infectious testing, she had some inflammation, so we worked on the inflammation, and then we treated her anxiety as well. What's the difference between sertraline and Depakote? Sertraline is an SSRI. Depakote's a mood stabilizer. That's the difference. Wow, thank you. Yeah. Alternative model for personality disorders. I mean, personality disorders, I think, it's just way of classifying things. All the DSM is just a way of classifying symptoms that we see. So I think until we get a neurobiological basis of diagnosis, then the DSM isn't really going to change that much or be that much more helpful. How often do you prescribe LAIs? I mean, I don't now because I work with a higher end population, a more well-functioning population. But when I was doing a lot of community mental health and my jail work, then I would prescribe a lot more LAIs then. My daughter has anxiety in the mornings until 2 p.m. Why is that? I'm not sure. Maybe it could be cortisol or something. Could be something stressful in the morning. I would suggest she gets an evaluation, or at least a consult. So that way, if she gets that evaluation or a consult, then you can pinpoint what the reason is. So if you want, I have a free mental health quiz in my bio that you can take, and that can be helpful for your daughter too. Do you think individuals need medication for ADHD? There are equivalent supplements. I don't think there's equivalent supplements. I think there's supplements that can be helpful, but I think that meds are stronger than supplements. So it depends on how severe your case is. That's the difference. Some people have just more of a severe case than others. Some people have less severe. So that's why it all just depends. Will Xanax affect my health? Yeah, Xanax it's not a good long-term med. It's fine short-term, but long-term it's hard to come off of. And it can cause dementia if taken all the time long-term. Do you work with people trying to come off long-term antidepressant use? Yeah, I have some patients I've tapered for antidepressants as well too. Typically we have to go a very low and slow approach, but I've had patients I've worked with to help them come off for sure. So yeah, I hope that this was helpful. Looks like we've been live for about 83 minutes. So yeah, if you are a PMHNP watching this and you want to learn more about coaching, you really want to level up your psychiatric skill set, learn diagnoses, psychiatric medications, how to manage complex patients, do complex pharm stuff in detail, and learn integrative psych, then definitely join or consider looking at our coaching program. And if you're a patient and you want to consider working with me, you can check out my bio for a free mental health quiz, or you can just send me a message. Otherwise, I hope this was helpful, and I